Good day, everyone. I am here again, and I brought to us advantages of laboratory tests before medication. My last topic, I talked about general side effects of self medications. So, and there are some people they said, why do I need to go for laboratory tests? Why not just go get since I know the symptoms, why not just go get the drugs that will heal the symptoms of disease? That's not right. The right procedure is when you have your signs and symptoms, you query a disease. The next thing you need to do is to go to laboratory for your tests or scans, x-rays, or whatever you need to do to diagnose the disease you're going through, and as well to give the right medication to your disease or the condition you are going through. So, what are the advantages of laboratory tests before medication? One, it helps to identify disease. It is very important to identify the disease you're going through. You name it, you know the name of the disease you're going through, so you can have the right treatment for it. It is important. So, please go for your laboratory test or scans or whatever it may be, x-rays, so you can identify the disease you're going through. Another one is to help monitor treatment progress. Yes, if you are going through a condition, a disease, and you are receiving treatment on it, you need to go for further tests and investigation so as to able to detect if there is improvement or in the treatment of that disease. So those are the advantages, yes. And also for accurate diagnosis, I said it earlier, for accurate diagnosis and effective treatment. Yes, there is this test we call MCS, microscopic sensitivity and um culture, and this test helps to detect the name of the organisms affecting you or causing that infection, and as well it gives the room to detect the the drugs you are resistant to and you're sensitive to, in which you will be able to know the drug you can use to kill such organisms and the drugs you cannot use, so giving you the open check to be able to make the right decision at the right time. So you won't make use of you won't make use of wrong drugs for the wrong disease. So you'll be able to, okay, this is, I'm going through Mycobacterium tuberculosis, and you'll be able to know the drugs that is sensitive to your body and you can use to kill the organisms at that particular time. Most of us, we are resistant to some drugs, especially antibiotics. Why? Because we make use of them wrongly, we misuse them, so we are resistant to them in such that those antibiotics, the common ones like ciprofloxacin, like gentamicin, like ceftriaxone, like tetracycline, we make use of them wrongly and our body becomes resistant to them, and they are not able to kill some bacteria in our body. Those bacteria grew over it, they grew and grew stronger to it. So laboratory tests will help you detect that disease and as well detect the sensitivity drugs that you can use to kill those disease. And also it helps to reduce your money. It helps for cost savings, so you won't spend extra. You have to spend according to the treatment you need. So you have to use different various drugs, so it will give you the direct drug where you need to cost your money on, and it helps to figure out most effective dose. Like I said earlier, it helps to detect the most effective ones, the most effective, just like the MCAs I said earlier. It will detect the most effective antibiotics you can use to kill those organisms in your body. So please, today it is important you go through your test to diagnose your disease before taking medication, to avoid unnecessary delay, to avoid spending unnecessarily, and to give you better treatment, to monitor your treatment as well, so you'll be fine at the end of the day. Thank you.